So my name is Susie Tinker. I've been the paediatric dermatology nurse at the Homerton for over 16 years.
Hello, my name is Mary Summerlad. I have been a consultant dermatologist at the Homerton for almost 3 years. And the bulk of our new referrals have eczema, and the majority of our follow-up patients also have eczema.
Eczema is the commonest childhood skin condition. About 1 in 5 children under the age of 5 have eczema. It's an unpredictable disease and no two children, even if they are related, experience it in the same way. Most children who get eczema will have experienced symptoms such as dry skin or itch before 12 months. And about 2/3 of children with eczema will no longer have eczema by the time they are 10 years old. About 1/3 of children will go on to have eczema in adulthood.
Eczema is a chronic disease, which means there is no cure for it, although it can be well managed to the point where it does not have a big impact on family life. The management of eczema revolves around 3 key principles: the liberal use of moisturisers every day, the use of alternatives to soap every day, and the use of topical steroids when the eczema is active.
In this video we are going to discuss emollients. Emollients are moisturisers that are used for a medical purpose rather than a cosmetic purpose. Although an emollient and a moisturiser do the same job of soothing and softening the skin, the term emollient is used for a product that is being used to treat skin conditions.
Emollients are essential in the management of eczema. They work by restoring the skin barrier which is damaged in eczema. This barrier reduces water loss from the skin and lowers the impact of environmental agents that can worsen eczema, such as water or heat. Emollients should be used between 4 and 6 times a day all over the body, not just the areas where you can see eczema. They should be applied in a downwards motion on the skin so as not to affect the direction of hair growth.
A child under the age of 5 should have their emollient applied first thing in the morning when they wake up, then every 2 to 3 hours throughout the day. An easy time to apply emollient is with nappy changes and immediately after the evening bath. Nursery or childminders should have the same emollient to be applied on the child while they're away from their parent or guardian.
A child over 5 should have their emollient applied first thing in the morning when they wake up, at lunchtime, at school, as soon as they're back from school, after their evening bath, and before bed if there is a difference of more than 2 hours between bath and bedtime.
Emollients are usually available as jars or bottles in volumes of 500 grams. For a child under 5 years, we recommend that as a minimum, the whole 500 gram jar or bottle should be finished within 2 weeks. For children over 12 years, 500 grams should be finished within 1 week. And for children between 5 and 12, they should be using between 250 grams and 500 grams per week, depending on how dry their skin gets and how big they are.
Most parents do not realise how often they need to use the emollient or how much emollient they need to use per week in order for their child's eczema to be considered effectively managed. Most GPs do not prescribe enough emollient per month per child, even though the NICE guidelines recommend children have large volumes of emollients in the region of between 250 and 500 grams per week.
Many parents and healthcare professionals want to know which is the best emollient. We always say the best emollient is one that the child is happy to have applied. There are several different emollients available to suit different skin types. Let parents and children try a variety of different emollients so they can be happy with their choice.
Although there is not the best emollient, we would urge you to ensure your patients are not using plant oils such as olive oil, coconut oil, shea butter or cocoa butter. Often these products are highly fragranced and contain colourings and preservatives that may worsen eczema.
We also advise against over-the-counter cosmetic moisturisers for children with eczema, even if they are found in the children's aisle of the supermarket. Again, often these products contain plant or herbal extracts that can exacerbate eczema, even if the product is advertised as for sensitive skin. Furthermore, these products can be expensive. Therefore, parents may buy the product less frequently than needed.
Medical emollients are made up of a combination of oil and water. Gels and lotions have a higher ratio of water than oil. They are easy to be applied, but as they have less oil, and oil restores the skin barrier, they need to be reapplied very frequently compared to creams and ointments, which have a higher amount of oil compared to water. For this reason, we advise against the use of lotions for eczema. Ointments are the greasiest. They work the best for very dry skin, but they can be messy and therefore they may not be well tolerated by children and parents. Usually, creams are acceptable as long-term emollients.
Now we will demonstrate how to apply ointments and creams. So now we're going to talk about the different kinds of emollients, and here's a gel emollient. So you need to pump sufficient on your hand, and then I'm going to apply to my arm, always in a downward motion. Don't go up and down. You've got to go in the way the hair follicles are going, otherwise you can get folliculitis. So rub sufficient in, and then you can apply to the other side, always down, face and body. And now we've got a cream. So these are more water-based, so it's lighter, probably better in the hot weather. Same application, put sufficient and go down. I'm going to use it on this side as well. Just down, down, not up and down, and put sufficient on everywhere on the body.
The heaviest of the emollients are the ointments. This is an example of an ointment-based moisturiser. You can see compared to the cream, it's much thicker. You may need to rub it onto your hand before applying it down, just for ease of application. And again, it's downwards in one direction, the downward hair growth direction, all over the body. This is the best for dry skin, flares of eczema. This is 50/50 ointment, which is the greasiest of all the emollients. Sometimes it can become quite liquidy in hot weather. It's the only ointment that we recommend you do not wash with, as it can make the bath very greasy. So it's a risk for slipping over. Again, applying the hands and go down in a downwards direction. You can use this anywhere on the body. It's really important that anyone who smokes does not use 50/50 ointment, because the paraffin is a risk of fires. So children who are around smokers, please warn them not to be around the smoker, and warn the smoker not to be around the child. Finally, we just wanted to show you aqueous cream. Aqueous cream several years ago was a very popular moisturiser, but we actually find that some of its ingredients can really irritate eczema. So we now recommend that people don't use aqueous cream as a leave-on moisturiser. If you have a family who are coming and using aqueous cream, we'd advise you to switch them over to a different ointment or cream-based treatment. And we're actually using aqueous cream less and less as a soap substitute as well, due to the irritation. So there you have gels, the lightest of the types of emollients, creams, kind of a nice middle ground, and ointments, the heaviest of them all.